I wanted to make sure to ask a few questions about the pandemic. And to do that, let's first pivot to some breaking news this morning. The Washington Post is reporting, or reported first at least, that the Biden administration will invest an additional $785 million into efforts to combat COVID in underrepresented communities. Doctor, $785 million, how necessary are those new funds, or is that just a drop in the bucket?
Well, all funds count. I think we have made enormous progress, and I think we're at another pivot in the pandemic that is worth reflecting on. From the beginning, the NIH received special appropriations to develop the Rapid Acceleration for Diagnostics program that developed these tests through incredible work done with companies and the NIH scientists. We also started a program for underserved populations that received an allocation of $500 million from Dr. Collins when this appropriation was made. And we have funded, at this point, 85 projects. They all have to be community engaged. It's to promote testing. We also have an important component on return to school, which has happened. And now we want to test to stay in school. We still see the data coming out of the CDC or any of the others who report data on COVID reports. Almost 50% of new cases, somewhere between 45 and 50% are from racial and ethnic minority groups, predominantly African American, Latino, and then a significant number of American Indian, Alaska Native, and Pacific Islanders, although they're very small populations. They're overrepresented in cases. Severity, hospitalization, and mortality follows in parallel. And vaccination rates, we're lagging behind, although we have, at least as of September, similar rates across those three main racial ethnic minority groups. Black, white, and Latino Hispanics are the same per the Kaiser Family Foundation survey. So we're pleased about that progress, but we cannot let our guard down. These individuals are more likely to work in public-facing jobs. They don't have the privilege that I do of staying home most of the time and working from and having my home office here. They're also in more crowded parts of living in more crowded urban parts of the city. They're also living sometimes 2 or 3 families in one household. And so the likelihood of being sheltering in place or staying away or not being infected goes down. I think vaccination has got to be the answer. We're getting there. We're made huge progress. And now that the reason I say pivot is because we're going to have oral therapy available pretty soon for early onset of symptoms. And that will make it much easier to treat people early on to prevent further transmission and individuals who have broken through and gotten infected even though they've been fully vaccinated. So we cannot let our guard down on this pandemic. This is not over by any stretch of the imagination.